Well, hello and welcome everybody to our webinar on planning a promotion-based response to COVID-19. It really is a great privilege for ADRA to host this webinar. Clearly a topical and important discussion for us to have in the very rapidly changing environment that COVID-19 is presenting our entire globe with at the moment. And I really want to welcome every single person who is participating in this call to the call. For those of you who don't know me, my name is Victoria Frey. I'm a WASH advisor for ADRA International, and I'm currently the HTLL chair, the Health Technical Learning Lab chair. So with me today, as you can see on your screen, or you should be able to see a screen, we will be showing the slides that are relevant to this webinar, and we will also be listening to a number of people who are presenting and facilitating the webinar. There will be an opportunity for questions and answers, and I just ask that as you have questions, if you could type those questions into your chat box. We will have a question and answer session at the end of the webinar, and we will be working through the various questions that people are asking, grouping them as required and answering them appropriately. We all come from a very wide range of backgrounds and a very wide range of interests and sectors, and we recognise that as we've been putting this webinar together, we've been very intentional to make sure that we are using evidence-based approaches, and at the same time we want to make sure that we are keeping the webinar simple. We want something to be practical and useful for us within the ADRA network. We're also really cognizant of the fact that there is a lot of information currently circulating and continuously circulating about COVID-19. This is not a webinar on how to wash your hands. There's plenty of other resources around for that. There also are a lot of other very technical resources available from a wide number of sources. This webinar is intended to be practical and simple, something that ADRA officers will find useful in the work that we are doing in the projects and programs that we are currently running, and how we are going to implement them maybe in a changed manner as we move forward in this situation. So I just want to point out that we're just going to be providing a starting point for a way that we can actually actively and practically react to and plan for the situation that we're finding ourselves in. So I just want to start off with a short word of prayer, and then we will commence our webinar. Dear Lord, we just want to ask you to be with us. We want to thank you and praise you that we are a network that is able to move forward with you by our side, walking in front of us and leading from the front as well as following from behind. We just want to acknowledge you and praise you. We want to seek you, and we want to ask you to be with us in this time, in unprecedented times. And we just want to ask you, Lord, to help us to be wise and to understand the context in which we're operating so that we can be effective and efficient and serve as many people as we possibly can. We praise you in your name. Amen.
Amen.
Okay, good morning, good afternoon, and good evening to everyone. My name is Josue Orellana, and let me get started now with the introduction of this topic. I guess, Victoria, you will be, since you have started with the slides, you will be the one passing the slides, right?
Actually, Jason is forwarding the slides on.
Okay.
Yep, that's okay. You don't have to worry about that, Josue.
Okay, okay. So what is COVID-19? Let me give a very brief overview. This is, as Victoria already said, this is not as a webinar on hand washing, neither this is a webinar on describing COVID-19, because you have plenty of information that you can find yourself online. And also this, the facts around it keep changing by the day, I would even say by the hour. Because this is something that is so new to all of us, less than 4 months that we have been looking at this issue. But let me just make an introduction to make sure we know what we are talking about. Probably, as all of you already know, COVID-19 stands for coronavirus disease 19, because it was first found in 2019. And as its name says, it is this is a new virus strain that belongs to the family of coronaviruses, which is the same family to which SARS and MERS, you might remember those previous epidemics, belong as well. These viruses are originally in animals, and these three coronaviruses are found in bats. But for some reason that we still don't know, there is transmission from animals, from one animal species to another one, and then finally to human beings, which is what happened in China a few months ago. So let's move forward now to the symptoms. Probably you already know this very well also, so we'll quickly go through it. The following symptoms may appear, I would say, between 2 to 14 days of exposure, but this information is still changing, as I said earlier. Fever seems to be the most common symptom that patients show. Coughing, it's also common. Shortness of breath. These are the key symptoms that are being used to identify patients, and there are other respiratory symptoms depending on the patient. Now let me make, Jason, if you can put the whole slide here. When to seek health care, when to seek medical care. If you have been in contact with a person if you have these symptoms, and if you have been in contact with a person known to have been diagnosed with COVID-19, or if you have been recently, that means during the past 14 days, if you have been traveling in an area where there is an active outbreak of COVID-19, that is the criteria for you to go and seek healthcare, seek medical care, or being tested. Otherwise, if you just have a runny nose or upper respiratory symptoms and then you go and try to get tested, probably you are just overwhelming the health facilities, the healthcare facilities that are trying to cope with all the patients that are seeking care over there. So this now let me make another point here. Jason, if you could for a while go back to. So, as probably you already know as well, out of 100 individuals who get infected with COVID-19, between 60, 70, or even up to 80% of them, up to 8 individuals, will show mild symptoms or even no symptoms at all. They will be asymptomatic. And only 20% or so will have more serious disease. And among them, around 5 to 6%, those percentages are also changing from almost every day. Around 5 to 6% will need intensive care. So that is important to remember when dealing with this disease. Now we will go to the next slide. So how can we protect ourselves and protect others around us? we already know the key messages. Probably you all are already aware, because campaigning is going around almost in every country now. Hand washing is very important, with making sure that soap remains on your hands for at least 20 seconds. I remember a few years ago, there was a campaign when the influenza H1N1 came out, and somehow people misunderstood the message in a country, and they thought they had to rinse their hands for 20 seconds. But that is not the idea. The idea is that soap stays on your hands for at least 20 seconds. Avoiding to touch your eyes, your nose, and your mouth, because those are the main points where the virus get inside your body. And maintaining social distance, at least 1 meter or 3 feet. In some guidelines, in some countries, they are even saying 2 meters, but between 1 to 2 meters, at least 1 meter is necessary. Stay home if you are sick. Not just sick with COVID-19, but if you have respiratory symptoms, or if you are yourself immunocompromised or not having good health, it's better to stay home. This is what we call cough etiquette, covering your mouth and your nose when you sneeze or when you cough. Not with your hand. If it is with your hand, you need to have a paper on your hand to cover your mouth and your nose, or you do it with your arm if you are not if you don't have anything on your hands. Regarding face masks, I think most of you already know that face masks are not effective to protect from contracting coronavirus infection. It is only recommended to use it if you are the one who is sick and you want to protect others, or if you are taking care of people who are sick. And there are, in every country, there is local guidance on how to do that. Although we also know that there is a lot of cultural implications in different parts of the world for using face masks. Cleaning and disinfecting frequently touched surfaces. We know that this novel coronavirus is being transmitted from person to person. We also know that it is transmitted through droplets, those small drops that when we sneeze or when we cough come out of our mouth, out of our nose, and can reach a person who is within 1 meter around us. And there is no proper evidence that this is an airborne disease, although there are already some scientists believing that it could have some airborne transmission, but there's no concluding evidence about that. The other important way of transmission is by what we call fomites, surfaces like doorknobs, like other desktops, tables, other surfaces that a person who is infected with it may touch, and then another person may touch the same surface. So that could be a way of transmission as well. And then we wanted to emphasize here another way of protecting yourself and others, which is keep up a good general health, which has mainly to do with your immune system. It is very important that we keep a strong immune system by just having a healthy lifestyle, eating lots of fruits and vegetables, having proper exposure and safe exposure to sunlight, drinking water, exercising. Rest is very important, that we sleep the necessary amount of time, especially to manage stress, because stress will really affect your immune system and your mental health, mental and spiritual health. Trusting in God is very important as well. Here I wanted to make an important point. I see some comments going around on social media saying that, yeah, you just need to keep good health, strengthen your immune system, and then let's welcome COVID-19. let's get infected because we will develop immunity easily and we will have only mild symptoms. It is true that you may have mild symptoms or even no symptoms if your immune system is strong, but first of all, there is no concluding evidence that your body will develop immunity. There are some evidences that there might be some short-term immunity, but there are also several cases that we already know that people who were reinfected in the short term, they got it twice already. So there seems to be some short-term immunity, especially in children, but evidence is still very limited. And the most important thing we should say about it is that we have to be responsible citizens. You know, we have to fulfill our social responsibility. What about if I get infected, I develop mild symptoms, but then I transmit it to someone else who doesn't have a strong immune system, and then that person develops severe disease. So that's why we have to keep the complete message. We have to do everything. We have to keep washing our hands and covering our cough, our sneeze, and keeping social distance and all the other measures while we strengthen our immune system. So this is a very brief introduction on COVID-19. And now I would like to pass it on to Elizabeth, who will be talking a little bit about the current situation.
Great, thank you so much, Josue. And hi, everybody. My name is Elizabeth Tomenko. I work on the emergency management team here at ADRA International. So I'll be providing a brief update on the situation globally, as well as sharing some resources. I'm going to paste into the chat box a link to a platform that you're welcome to follow along, and I'll also screen share it. Let me see. This is a platform that we are using and recommending for tracking cases. This is the COVID-19 dashboard of global cases developed and managed by Johns Hopkins University. You should be able to see it on the screen share now. This is a free resource that anyone can access online. And this is updated many times a day, every hour or every few hours as data is available. So we can see that as of the latest available data, there are currently over 169,000 confirmed cases globally across 148 different countries or regions. And just for comparison, 1 week ago on March 9th, there were just over 113 confirmed cases globally. And 1 month ago on February 16, there were just over 71,000 global cases. So we can see how quickly this is spreading around the world. Keep in mind that these figures are only reporting laboratory or unknown what's being reflected here. So if you're following along, you can scroll through this list on the left to see the countries with confirmed cases so far. Some countries such as China, Australia, Canada, the US also provide subnational data that disaggregates cases by state or province. So just to demonstrate this, since I'm based in the US here, I will click on US, and you'll see the map will zoom into the area. And if I click down here, I can now view the information disaggregated by state. So I can see the number of confirmed cases by state in the US, as well as over here on the right, the confirmed number of deaths and recovered by state in the US. And this information is available for a handful of other countries as well. I'll just refresh the page so we can see the global figures again. Another feature on the map is the cumulative versus active cases. We can see these tabs at the bottom bottom left of the map, we see cumulative confirmed cases and active cases. Now, if we take China as an example, which has the most number of cases globally, on the cumulative map here, we see a very large red circle around where China is. And if we click on active cases, we see the circle for China get quite a bit smaller, as thousands of cases have either recovered from the disease or resulted in deaths. So here I'll switch back and forth just a few times so you can see how this circle gets quite a bit smaller when we look only at the active cases. And at the bottom right, and there are 3 tabs for 3 different graphs. And if I click here, I can expand this to view the graphs. The first and default graph shows the actual number of total cases. First in mainland China in orange, which more or less started to plateau since mid-February. And then elsewhere in the world is reflected in yellow, which we can see has spiked dramatically since early March. And in green, it shows the total number of people who have recovered anywhere in the world, and we can see this number continues to increase. The second tab shows the logarithmic scale. For this one, just notice that on the y-axis on the left, that the scale of the number of cases is increasing exponentially by powers of 10, whereas on the graph with actual numbers, it was by consistent increments of 10,000. So the large discrepancies of values on a single axis. The last one I'll show you is the daily cases. So here we can see the total number of new confirmed cases and new confirmed recoveries by day. And this is also helpful to look back at historical data. We can see the number by hovering on a bar. So new confirmed cases are reflected in red. Here, if I hover on this bar from March 14, I can see that there were 11,600 new confirmed cases that day. New recoveries per day are reflected by the green bars. I can see for the same day, there were 2,400 new recoveries reported that day, and so on for different days. I would just like to note, so everybody's aware, there have been a number of spoof or spam websites come up that attempt to look like this Johns Hopkins COVID-19 dashboard. So when you visit this, make sure you go to the real website. You can follow the link that I pasted into the Zoom chat for this webinar. We've also linked to this on eNet. So that's one of the ways that you can ensure that you always go to the correct website and not a scam website. I'll also just provide a very brief update on ADRA's global response so far to the COVID-19 pandemic. And I'm sure many of you reflected on this call have been involved with these activities already. ADRA offices around the world have been preparing risk analyses, business continuity plans for their offices, in addition to response plans to help respond and prevent the spread of the virus and address it where it's already spread. In South Korea, ADRA is planning to address some of the second order impacts and economic impacts by distributing food rations to low-income households that have been economically affected by fewer job opportunities as a result of many things shutting down because of the virus. ADRA is also working with donors to import much needed medical supplies and personal protective equipment to support hospital operations in Hong Kong. And various ADRA offices around the world are working with their local media, Hope Channel, and other Adventist media channels to share information about COVID-19 and best practices on preventative measures to stop the spread of the virus. And as the situation is changing daily and hourly, ADRA is proactively staying on top of the latest information and advising ADRA's offices and staff around the world on how to keep themselves and community members safe. So that's all from me. I will hand over to Jason now.
Thanks everyone for sharing. And we're going to switch back to our other view here. And let's see, 1 second here to get our share back up. Great. And thank you, Liz, for talking to us about the current situation. And we're going to talk about why are we focusing on promotion today. So the title of our webinar obviously is a promotion-based response. And currently, the best non-pharmaceutical intervention for humanitarian actors is to, in order to prevent the spread of COVID-19, is promotion of accurate information and protective behaviors for individuals and groups. We do have offices that are doing other things as the local context dictates, but this is something we wanted to focus on in this webinar. There may be others, and at some point we may go deeper into this question of promotion and talk about SBC and bring in some experts. But right now we wanted to give a simple introduction to how to prepare a promotion-based response. A second reason that we're focusing on promotion is that while simple actions can protect individuals and families from infection, they need to be practiced correctly and consistently. And if not, they may give participants a false sense of security while they remain unprotected. And also, there's a lot of misinformation that's being communicated. Promotion should point hearers to authoritative sources. So one of our goals today is not to tell you that, we know it all, but rather we're going to talk about general approaches to promotion and refer you back to and have you continue looking at those authoritative sources like the WHO, your own public health authorities in your country, or the CDC. So let's go ahead and talk about why we need a plan. Why do we need a promotion plan? Well, I review lots of proposals and work with multiple donors, and it's not uncommon to have promotion or sensitization listed as a side activity. Basically, we're going to do this, we're going to distribute, we're going to perform these activities, and by the way, we're going to do some promotion on the side. And the challenge is that it's often not given the same attention or planning as a distribution or another type of response. And a good plan is going to not only lay out what we're going to do, but how we will adaptively manage the activities in light of new information or changing context. And that is especially important in the case of COVID-19. As Dr. Oriana was saying, things are changing virtually on a day-to-day basis. And as the context changes, as information changes, we need a plan in place so that we can adapt to it. A plan also allows us to communicate effectively with authorities and manage expectations. And a plan includes monitoring, evaluation, and learning. If a plan does not include that, it's not going to be able to adapt to new situations. But on a very basic level, we're not even going to know if it's working. So let's talk about what is effective promotion. How do we know when it's working? Effective promotion leads to change in behavior, not only an increase in knowledge. And what we know is that you can change the knowledge that a person has without affecting their behavior. And I could take a poll right now and say, how many people here know that you need to exercise for 30 minutes a day? And then we could follow that up with a question, but how many people do it? And speaking for myself, I know that information, I know those facts, but it hasn't necessarily changed my behavior. So effective promotion changes behavior. It doesn't just increase knowledge. The objective is not to have people know information. It is for the behaviors or actions to be practiced, and this is really important, correctly and consistently. Effective promotion is targeted. It takes into account motivations and challenges, sometimes we call those barriers, that hearers may have or think they have in following the promoted practices. And those receiving promotion should see the practices as clear, simple to do, and effective. And in this way, when they hear it, they won't say, oh, I could never do that. That's too complex. They need to view the actions as doable, or they may become discouraged before they even get started. And also, just a word to say that promoting practices by taking into account all of these factors is called social behavior change or social behavior change communication. You may have heard this reference to SBC or SBCC, and this is not a webinar on SBC because that's a larger topic. We do have experts in the network. It may be something that there's an interest in doing in the future. But really, this is just an introduction to some very basic approaches to promotion. So let me give you one example from donor guidelines, just so you know that this is not something that is out of the ordinary. So this is directly out of the 2018 guidance for USAID and OFTA. And this is what it says, that you must specify, and this is under hygiene promotion, but just so you know, it comes up in multiple places, the behaviors that will be included in the project, the motives for behavior change, the conditions required to enable the behaviors, and you must explicitly state the tools and approaches that will be used to identify the priority behaviors and or the motives for change. Now, if you don't understand all those terms, that's part of what we're here to discuss. But I'm just pointing out here that most major donors do require a plan for, it might reference a social behavior change plan or a promotion plan. And this particular donor goes on to say that you must identify the specific audiences for each behavior, and that those that will be included in the project, and the specific communication channels, and how you made sure that they were appropriate. Now, all of these things would fall into creating a plan, and just for reference there, those are from the USAID OFTA proposal guidelines. But I think you'll find that most major donors have some sort of requirement that you make a plan when you're doing promotion. So what does a plan include? And here are some of the elements that you saw listed in those donor requirements that I looked at. So key behaviors. What do we want to promote? The question here is, what do we want our hearers to do? What is the action that we want them to take? The practice that we want them to adopt? Secondly, who's the target audience? Who needs to practice the behavior, or in some cases, such as for small children, who needs to assure that the behavior is done? Those individuals would be referred to as our target audience. Determinants. This one is the one that takes a little more time to explain and that we don't have a lot of time to delve into. But if I could describe it in basic terms, I would say, what motivation do we plan to tap into as we're speaking to people? When information or a message actually changes behavior, it's because it taps into existing motivations. And the key message, what should it look like? The key message should be concise, clear, consistent, and targeted. And it needs to be delivered by all promotion activities. You know, sometimes we evaluate projects, we go to the field, and as we move from place to place, talking to different agents, field agents, for example, in the project, what becomes clear is that not everyone is getting the same message. And if the message is not concise, clear, and consistent, then confusion can result. And I think we've seen a lot of examples of that in this coronavirus information that we've seen coming out. Next, what are the means of communication? How and where will the messages be disseminated? And again, these are the parts of a plan. And finally, the frequency. How often will the full message be delivered? So fairly simple so far. And there's one very, very important element of the plan that needs to be included that isn't necessarily called for in your typical proposal guidelines, but the expectation is that you'll also have a monitoring, evaluation, and learning plan. And the question is, how do we know what's working? How do we know if behavior is really being changed? And the only way to know that is to have a plan for how and when the plan needs to be modified. So this might be included in your meal plan. You know, how often are we going to meet to discuss the results? How often are we going to hold focus groups to determine what message is actually being received? Who will be responsible for calling that meeting? And what will be the process for updating our messaging? So let's quickly delve into each of these elements of a plan. So we have key behaviors. What do we want our hearers to do, adopt, or practice? And the key behaviors are linked to the objectives of the project. Every project objective has some sort of behavior attached to it. And you might say, well, what about distribution? Yes, we still need people to come to the distribution site. We still need people to properly use the things that are being distributed. So even something like distribution has behaviors linked to it, and those behaviors require promotion. So the objective may be to improve health, for example, in a project, but the behavior might be requiring, the behavior required to improve health might be hand washing with soap at critical times, for example. The target audience. This is extremely important. Who needs to practice the behavior or assure that it's done? To be effective, the person needing to take the identified actions must be specifically addressed. So when you hear a message, one of the things you're asking yourself is, does it apply to me? And there should never be any doubt in the minds of the target audience when they hear the message. If it's well crafted, yes, this message is for you. This message is targeted to you. And in order to do that, we need to understand that target audience, the demographics of the people we're trying to reach, their lifestyle, their habits, and their aspirations. All of these things feed into the question of how do we reach someone effectively with a message, and how does that result in behavior change? So an example of not understanding our target audience might be that we plan to do a messaging campaign at a distribution site. Yet the key audience, it turns out, is not the person who picks up the ration or the thing being distributed. I remember this in a recent project that we were targeting mothers as the target audience, and that one of the things happened was that we said we were going to promote key messages at the distribution site. The problem is that the mothers were not coming to the distribution site because we didn't understand the target audience, so the message was not received. And determinants and behaviors. So what is the motivation of the people that will be hearing the message? How do we feel like, what are we going to appeal to in terms of their motivation in order to be able to address them in a way that they will respond to, that they will hear. And this element of the plan is usually determined by formative research, such as a barrier analysis, but with an emergency, we may not have time for this. So a quick focus group might be the only way to do this initially. And then the plan is to follow up with monitoring evaluation to see if the messaging that we have created is working. I know that our time is moving quickly. We want to have time to get to the question and answers. So I'm going to maybe skip over a couple of things. I know that the questions that you're putting into the chat are being compiled, and we want to get to those. So we're going to move through this section on the rest of the plan quickly so that we can get to some of your questions. But I do want to focus in particular on how we design the message so that it's concise, clear, consistent, and targeted. So here is one way to do that. This is a formula that we can use to test our message. So to promote X behavior, so maybe we're talking about hand washing or, social isolation among this key audience. So we would insert here, who is the primary audience? Is it mothers? Is it children? We will appeal to what motivation? And even though we didn't have a lot of time to go in this, what would be a common motivation for getting people to practice a health-related behavior? It might be fear of negative consequences. So for example, a negative consequence would obviously be in getting infected with COVID-19. So to promote hand washing among mothers, we will use a fear of negative consequences to deliver the message, what? And this is where we actually insert the exact wording of the message that we're going to formulate. And then the formula also describes how and where the message will be disseminated, and also how often. So let's look at this quickly. And this is a little matrix that is developed from the donor guidance. And if you look across the top, these are the key elements of the plan. What are the key behaviors? Who is the target audience? What are the key behavioral determinants targeted, or motivations as we describe them? The key message, the means of communication, and the frequency. So here's a little example we can look at. If the behavior is that we want people to consistently perform hand washing with soap, all family members, perhaps we say the person who is most likely to practice or to assure that practice, the key target audience is mothers. And we're going to talk about the perceived negative consequences of not doing it. Our message might read something like this: hand washing with soap at the 5 critical times prevents your children from getting sick. Clear, concise, targeted to a specific audience with a specific motivation. And then the means of communication. Now, in the case of COVID-19, face-to-face may not be your means of communication, or gathering people in groups. But how will you communicate with people? And finally, the frequency. So here's our little formula, which we are going to provide to you afterwards. By the way, we have some tools to lay this out. To promote consistent hand washing with soap by all family members among mothers, we will use perceived negative consequences and deliver the message: hand washing with soap at the 5 critical times prevents your children from getting sick, with group meetings on a monthly basis. So that's just an example of how it might look. I'm going to go quickly through monitoring and evaluation and learning. I think we've already made the case that for the importance of this activity, and just a few things to keep note of. The meal plan lays out how we're going to monitor, evaluate, and learn. The questions we're going to ask is it working? And the key way that we're going to know it's working is not that people know the information, rather that they're actually doing the practices that are being promoted. We're going to talk about how often is the plan going to be reviewed, who's responsible, and what corrective actions will be taken. This is called adaptive management. Finally, what did we learn from this whole process, and how was it documented? So we have a little saying that says, if it wasn't written down, it didn't happen. If it wasn't documented and it wasn't shared, it's not learning. So just in conclusion, before we go to the questions and answers, effective promotion requires a plan. Effective promotion changes behavior instead of simply increasing knowledge. There are many simple tools to formulate a plan. There are various ones out there. Various donors may promote different tools. The plan needs to be monitored, evaluated, and adapted to changing context and changing information. The basic metric is not what do people know, but what are they practicing? And finally, I just wanted to say, if you are interested in going deeper with social behavior change, it is increasingly a requirement of donors for all projects, and there are many different approaches, different experts and resources available, including in the network. And Adder International will be providing a link to ENET. You can also contact the presenters to let us know if you don't have access to that. And we do want to leave time for the questions and answers. So I'm actually going to be handing over to Deborah so that she can summarize some of the questions that have come in. And our apologies if we can't get to them all given the time we have, but I believe our panel is standing by. We may not be able to answer all your questions, but we will definitely give it a try. So Deborah, can you share with us some of the questions that have come up?
Yes, absolutely. Can everyone hear me okay?
You're a little bit soft, Deborah.
Okay, I will try and talk a little bit louder and see if that helps. Good morning, good afternoon, good evening, everyone. Welcome. Thank you for your participation, and many thanks to our presenters for all the valuable and timely information that you've shared so far. There were a number of questions sent in, and I'll do my best to group them in order to make the time serve us better. Let's start out with a question about some of the COVID-19 determinants, barriers, but also it's a more general question that I'll direct to you, Jason. In regards to, you emphasized that there are key determinants or motivations to our behaviors, as well as barriers that can exist to adopting those behaviors. The question was, is there a list or some kind of resource that shares common motivations or determinants that we could use to brainstorm our own response-specific motivations or determinants that can be adapted or used as a starting point when we're having those discussions?
Absolutely. You know, and I think there are a couple of different ways to think of this. There are certainly recognized determinants of behavior which are considered somewhat universal. Depending on the list, you may find 11 or 12, but let me give you something actually more simple. Do a focus group. Ask people, what are your challenges? What do you find difficult about this situation? Is it, or you know, what are the reasons that people are giving why they're not practicing behaviors. And we can do something like a barrier analysis. There are very, scientific, formative research methodologies to find these kind of things out. And I do encourage you to look at those key determinants like perception of negative consequences, perception of positive consequences, or self-efficacy. And let me just give you one example of self-efficacy. So self-efficacy is the belief that you can do it. So imagine that a promotion is happening and it lists 25 different steps to do something. These are the 25 steps you need to do to protect yourself from coronavirus. If people hear that and they say, oh my goodness, that's just too much, I could never do it. The barrier in this case would be that people do not perceive that they have the ability to do all of those things. So if you're hearing that people feel overwhelmed by the absolute quantity of information, one of the key things that you might address in your messaging is to say, look, there are some basic, simple, doable things that you can do to protect yourself and your family, and it is XYZ. Or, the other thing is that people are often motivated by negative consequences. If you don't do X, this bad thing is going to happen to you. But there's a lot of research that shows that people are more motivated by positive consequences. If you do X, Y, and Z, you will be healthy. Your children will be healthy. And really the best way to think about determinants and which ones you might use is you have to start with, communication with people that you have access to, and then you have to test it. If it turns out that your messaging is not working the way that you had hoped, you need to look at it again, and you need to ask people why. The other reference was to barriers. So what might be a physical barrier in some cases? Very simple example. Here in the US, you can no longer buy alcohol-based hand sanitizer. So if your message is, make sure you wash your hands with soap or use hand sanitizer, and people say, oh, but I can't buy soap, or I can't, hand sanitizer is no longer available, those are barriers. And you have to be prepared to address those in your messaging. I hope that helps. And we will definitely link to more resources about determinants of behavior and how to use them.
Thank you for that, Jason. I know that was very valuable feedback, and thank you for the future link to the resources. Just to comment, everyone, we wanted to point out that we will be sharing a recording of this webinar with all of you. It looks like we are going to go over time with the questions, and I know many of you are in places where it might be inconvenient to stay longer. So just to make everyone aware, we will be sharing this recording. It will include all of the oral as well as the visual resources. We will also be sharing out the hand washing video that many of you have seen that's been posted on YouTube. That way you can use it in your health promotion and wash promotion activities as well. You will have the ability to add subtitles to it through your own resources and mechanisms, but we will share the original along with this webinar recording, and they will also be made available through the regular channels through our eNet page, etc. We'll go over a little bit with the questions. You're all welcome to stay and participate, but for those of you who need to go, we wanted to make sure to share that information before you leave. Another point that has been, for those of you who've been monitoring the chat box, we have shared several resources there. The eNet page link has been shared where our kind and hardworking friends in the Emergency Management Unit, as well as those who are responding around the world, are providing a lot of resources from experts on the subject. They're on eNet, lots of links, lots of resources that you can access in your own promotion activities. So please do make use of that. It is there for your use. Also, the best, as Jason pointed out, the best route, the best approach in any kind of promotion activity is to provide accurate information. And we want to make sure that anything we're providing, especially if we're presenting ourselves as experts on the subject, anything we're providing is vetted and has a scientific basis. And with that desire, we've provided the WHO website link where they have all the latest information. They have guidelines, they have accurate information about COVID-19 and what it will and won't do. So make sure that you access those links as well when you are providing any kind of promotion activities. All right, continuing on with the questions. There is a point that's come up, and I'd like to thank Netsai, our network nutrition technical advisor, who is both on the HTLL as well as working with ADRA International. She brought up a question that probably doesn't come up in most of our minds unless we've experienced breastfeeding in some peripheral way. And her comment is that there are several resources coming out around COVID-19 and breastfeeding. When to continue encouraging breastfeeding. Also, if we're talking about pregnant mothers, what in particular they need to look out for. So we'll make sure that that is included in the packet that gets shared out as well. Okay, a few nitty-gritty questions about COVID-19 that are less related probably to promotion, but will help us clarify a few of the points that we want to promote in our individual activities. One question that came, I will direct, in fact, many of these I will direct to you, Dr. Oriana. The first one should be important to all of us as we try to identify when we should be concerned about COVID-19 and when it's something perhaps less concerning. And that is, what are the differences between flu type A and COVID-19? How can we tell if we just have what many of us know as the regular flu, and how can we tell if it's COVID-19? So I'll hand that over to you, Dr. Oriana, to answer.
Thank you. So COVID-19 has flu-like symptoms. So there is no clear day or night difference. The actual way to tell the difference is by the test, having the laboratory test. There are people trying to identify different way of symptoms, but symptoms can vary also in one disease and the other. The only way to truly tell the difference is by laboratory test. Now, when it comes to seeking for medical care, it is important to mention that from country to country, the specific criteria for being tested also can vary depending on how the epidemic is going. As I said at the beginning, let us not overwhelm the health facilities unnecessarily. So in many countries, people are actually advising, governments are actually advising to call your doctor or your clinic before you actually go there, to not go there unnecessarily. But when it comes to telling the difference, it's really just by laboratory.
Thank you so much, Dr. Oriana. Any follow-up questions on that, please do send through to us. Another question that came through is probably for Jason. We want to ask, Fletchy sent in a question, how will the focus groups be conducted if we are discouraging meetings? How could the information about adoption be captured? Again, if we are discouraging meetings and we're encouraging social isolation. Jason?
That's a great question. I know, for example, that the church that I attend was not able to meet in person this week. They actually used Facebook Live to conduct this service, and people were listening in from home. I think that we're all going to be really stretched going forward. And I think that what we need to possibly consider is using our existing networks, the people that we communicate with on a daily basis, and just helping them to have the best, most accurate information possible. This is a little bit of a new, this is a new context. The other thing is, as a humanitarian agency, we're definitely taking back the back seat to whatever our respective governments and local authorities are doing here and seeking to be supportive. So one of the things I would definitely want to make sure of is that not only are we citing authoritative materials, but we're reaching out to and coordinating with the proper government authorities. At the same time, those that you do have influence with, whether it's through your social media, whether it's through, virtual church gatherings like the one that I attended this week, let's just make sure that we are sharing accurate information and using the influence that we have as ADRA wisely. That's really all I can say about this. So if anyone has any great ideas about how to work in this new context, I think that we're all looking for those answers.
Thank you, Jason. Feel free to share back any feedback. It's a little bit early here. Share back any feedback in the chat box to Jason's comment. In the meantime, I have a couple of questions I'd like to direct to Dr. Orellana. The first, you mentioned that wearing masks at this point is something that's only suggested by the experts if one has COVID-19 and is trying to protect others, or if one is in a high-risk situation like in a healthcare setting. The question is related to that, but what about wearing gloves, especially if we're talking about shopping outside the home for necessities? Does this provide protection, or is it just another magnet for the virus?
That's a great question. And it seems, it may seem as something very, very good to protect yourself by wearing gloves. The point is, it is not practical. If you ask a surgeon, the procedure they use to put on their gloves and to remove them from their hands, they have to use a kind of protocol. And as soon as they know they have touched an unclean surface, they have to immediately remove and discard those gloves. So it is not really practical, and it could actually increase the risk if you don't do it properly. So hand washing still remains as the main way of keeping yourself, preventing transmission.
Thank you very much. Second question for you as well. How many, and again, we understand you're not a virologist, but thank you for providing all of this. Thank you for being our conduit for all of this important information. The second question is, how many hours or days does the virus survive on touched surfaces? You mentioned fomites like door handles or office desks or chairs. How many hours or days does it survive, or is that relevant?
Well, it's still early to say categorically how many hours the virus survives. WHO has initially said from a few hours to a few days, but there are more recent studies showing that depending on the surface, it could vary between up to 24 hours or even up to 72 hours. It's still early, but we know that the practical implication here will be please clean surfaces on a daily basis or even several times a day. That's the practical implication.
All right, and this is the last question we have now for you, Dr. Orellana, and that is a somewhat general one that's come from several different several different sources. You mentioned that it's important to keep up our immune system, and you briefly mentioned a few different ways that could be done. The question is, since a lot of underlying lifestyle or non-communicable disease issues seem to be aggravating COVID-19, what is a good resource for these kinds of behavior change activities? Things like encouraging people to drink more water, exercise, etc. Is there a resource that you can share with us that might be useful when pursuing this kind of health promotion activity? And how can we make sure that the information that we're sharing is scientifically sound and accurate?
Well, thank you. That's a very important question. Let me start by repeating what I said earlier. It is very important that we convey as much as possible a complete message. I have been looking at some of the comments on the chat and looking at plenty of information that is published on social media, on YouTube, and even some of our Adventist speakers, sometimes in some media outlets, are speaking about it. I have to say that sometimes we only show part of the message. Sometimes we only talk about, for example, we may only talk about hand washing and social distancing and those kind of things, which are very important, recommended by WHO and all the authoritative sources. But on the other hand, there are people who are only talking about strengthen your immune system and then everything will be okay. As I said earlier, you know, we also need to be responsible citizens and making sure that we are not transmitting it to someone else who might have a weaker immune system. So as much as possible, let's have the complete message to people. Now, when it comes to strengthening our immune system, there are again many comments going around and many myths, people talking about garlic and onions and many other things. Garlic and onions are very good elements that God has created for us, but they have a role to play. And it's still too early to say that garlic kills the virus. There is no scientific evidence around that. What we know right now is that garlic strengthens our immune system in general. So whatever comes, your immune system will be stronger. That's what we can say specifically about that, those comments that were circulating around. But to your question, we will search and post in the package of resources because there is already plenty of information around. We will search and post there some good source of information that is balanced, that is not biased, for you all to share. Now, I have seen some comments about using New Start, using CHIP, or Celebration has been mentioned also. Most of these approaches are trademarked, are protected, but most of them are available for you to use also. So you can, to promote lifestyle, you can use whatever fits best into your local situation, whatever is available for you, or not even using a specific approach, just promoting laws of health and basic principles of a healthy lifestyle will help. We will have some information later for you in the package of resources.
Thank you very much. We're down to our final two questions. And if there are any follow-up questions, please don't hesitate to reach out to us. We'll make sure that those are addressed in any follow-up communication. Briefly, and I believe these are both for you also, Josue, there are two that seem to be somewhat related. I'll see if I can summarize. At the start of the crisis, the World Health Organization estimated that around 65 million people would be infected with the virus. What can we do to plan for such a situation? And also an associated question is, the cases in China, at least the active cases, seem to be slowing down as compared to February. And the question is this because of strict quarantine measures, or is there any herd immunity that can be developed to COVID-19?
So I will lead the first part of the question.
The first part of the question is, my toddler has just joined us on the call. The question is, how can we, with the big numbers that the WHO is talking about, 65 million people, all the millions of people around the world that could be affected, how can we plan for something at that scale? And the question is there herd immunity?
Okay. So to the first question, and Liz can say more about that. What I can say is, for at least as of now, the ADRA network has decided to focus more on the second pillar of WHO's approach to deal with this case, with this pandemic, which is basically about community engagement and about messaging, health education. That's why we are conducting this webinar, to provide some resources to country offices. I'm happy that people are posting links to more information where you can find more SBC resources, because in 1 hour, it's definitely not possible to share much. But we want to focus on that because we see there is a role for ADRA to play. ADRA has already some expertise in promoting behavior change related to hygiene. So we want to leverage on that. Apart from that, if depending on the specific situation of your country office and depending on the specific situation of how the outbreak is going on in your country, you can also think about other interventions, like, for example, supporting the government in case finding or case tracing. In some cases, governments are open to use volunteers, not necessarily medical staff, for case finding, especially to interview contacts. Of course, they have to provide, or somebody will need to provide the necessary protective equipment, personal protective equipment. But then volunteers who are trained, even though they don't have a health background, if they are trained, they can support the government as well. Another way of a potential response could be trainings for healthcare workers on infection prevention and control. That is also a great need in some countries. And as this pandemic grows more into Africa, into Asia, and Latin America, there might be cases in which governments are not able to train their own healthcare workforce. So they might need some support in that regard. So those are just some examples of specific interventions that you can think about. But definitely what we as a network are thinking is the best way to intervene is by messaging, by doing health education around hand washing and other key messages. And also, as Liz said earlier, by addressing the secondary implications of this pandemic, like distributing food and supporting people who are more vulnerable, and because of the restrictions that governments are placing, maybe their livelihoods are being affected. So there might be other ways to intervene as well, thinking locally, thinking in your specific setting. Then can you remind me what was the second part of the question?
Yes, absolutely. The second part was if we we're seeing the numbers of active cases going down in China.
Okay.
The question is this due to quarantine, or is there some kind of herd immunity that can be developed?
Well, China has definitely used very strong and strict measures of containment and mitigation, both. Those measures it will be very difficult to replicate that in other countries. So they have worked a lot on that. And now the changes in this process in China could be due to that. Immunity is still early to say if there is immunity. There are some cases, as I mentioned earlier. There seems to be short-term immunity, but evidence is not yet conclusive. So, and it's still early. We don't know what's going to happen. hopefully that will continue to be the case, at least in China and in other countries as well. But the best we can do right now is to keep promoting these key messages the best we can.
Thank you, Josue. The last question is just a quick one, and then we'll refer the rest of the questions for later follow-up. The question is, do we know if the virus can be transmitted through in vitro to the child of a pregnant mother, or can it also go through breast milk?
Again, it's very early to have concluding evidence about that, but we know about the other two coronaviruses, MERS and SARS, that they don't show vertical transmission. That means from mother to fetus. So hopefully that is the case. There has been already some publication of one case in China of a woman, pregnant woman, who gave birth through a cesarean section, and she was positive and she was diagnosed with COVID-19, and the baby was tested and tested negative. That is encouraging, but again, it's just one case, and there might be a few other cases around. But hopefully there is no vertical transmission, as is the case with SARS and MERS. There are several recommendations about lactating mothers. There is no clear evidence right now that the virus can be transmitted through breast milk. But again, it is quite early to say that categorically.
Thank you so much. Thank you to all the participants who have stayed with us this long. There are two important questions that have come up that I would like to address now, but we will have further follow-up on them later. The first is, do we have ADRA global safety protocols for office and project fields before entering the fields and preparing for possible exposure, especially if we're talking about being not only in the field and responding, but on leaves, R&R, and traveling. And also, an addendum to that is, what protocols for ADRA, if any, for our staff or staff's family members to make sure that there's proper tracing by the government, to make sure that we're following quarantines, when to halt operations. These are excellent questions. They are beyond the scope a little bit of what we're talking about, so we'll see what we can do to find the answers to those questions. At this point, it was mentioned already in the webinar that we want to make sure that we're responding appropriately locally, both culturally as well as scientifically. And as has already been pointed out, there are several elements that are different and vary from government to government as to what is and isn't suggested. So what we'll do is we will look into the question of what protocols and policies and procedures we have as ADRA network, and we'll make sure that that's included in the follow-up. Obviously, this is a somewhat unique situation that most of us haven't lived through before, and many of the decisions we're having to make based on no previous experience, no previous protocols. So let's see what we can find from our colleagues on the network level, and we'll get back to you. Any other questions? Feel free to direct them either through the chat just now or send them through to any of us who are participating in the call. We'll make sure that we follow up on those afterward. Thank you so much for your participation. I'm going to hand it over to Victoria just to close us out. And thank you all for participating and sticking with us this long. Victoria, it's all yours.
Thank you, Deborah. Thank you, everybody, for your fantastic questions. It's certainly a really important part of our webinar to be able to understand and hear from the listeners, the participants, what sort of questions you've got. I think it's been a really valuable opportunity to share within our network some of the questions and the opportunities we have to answer those questions as we are finding them in our work. And as Deborah has said, that we will also be sharing the resources that we've discussed and presented and answered in this webinar. So please do look out for those resources which will be available for you. And again, thank you very much for participating in our HTLL webinar. We hope and pray that this situation will pass as things do, and that the work that we do and the people that we work with will be affected in the most minimal way possible. So yeah, take care everybody, and we look forward to hearing again from you soon.